Spain. Today we are going to talk about skin rejuvenation in complicated areas. We are going to talk about skin rejuvenation around the eyes and in the neck area. Why is those two complicated areas? It's related with the thickness of the dermis. We know that the regular thickness of the dermis in our face is around 2.53 millimeters. And we know that in areas like around the eyes and the necks, this thickness is reduced to next to a half, to 1.5 millimeters. So evidently we have a lot of techniques to help the body, to help the skin to be rejuvenated. So we have the traditional peelings, we have the mesotherapy, we have the lasers, the ablative lasers, CO2 fraction laser, erbium fraction laser, and we have also the fraction non-ablative lasers. All those technologies are very interesting, but the problem is if we don't put enough energy, we don't have results, and if we put a bit extra energy, we can generate secondary effects. Which one? For example, post-inflammatory pigmentation related with the oxidation of iron intra-erythrocytes. Second, and much more important, retraction of the tissue who are non-wanted. For example, around the neck, we know that if we treat with CO2 fractional laser and erbium fractional laser, we can have secondary effect like huge retraction of the skin. So how to improve the condition of the skin without those secondary effects? We know that around the thighs, the botulinum toxin is one of the best solutions we have. We know also that the results are maintained only between 4 and 6 months. But there are many patients who don't want to be injected, and there are many patients who want a long-lasting result. Can the surgery give us a result in those wrinkles around the eyes? The answer is no. We have botulinum toxin or we have technology. And in the technology, if we want to do it with long-lasting results without those secondary effects, we have just two opportunities to do it. One with the non-ablative fraction lasers, the second one with the ablative radiofrequency. Which one is the big difference between both? Fractional radiofrequency, the new generation of fractional radiofrequency, the ablative ones, came to the market to give us the exact same amount of coagulation of the non-ablative fractional laser plus some ablation in the surface. This ablation is also absolutely necessary to regenerate the epidermis. When we do the treatment, and the treatment doesn't take us more than 15 minutes, we assume that we are going to achieve a coagulation, so an increase of temperature between 60 and 65 degrees Celsius at a thickness of 1 millimeter. So we don't assume risk on treatments. We don't assume risk of scarring, and we don't assume risk of retraction on the neck. So we know exactly the maximum deepness we are going to achieve with ablation and coagulation. Ablation 600 microns, coagulation next to 1 millimeter. So we cannot achieve deeper penetration, so we limitate the risk. So how many sessions and which one are the physiological effects on the tissue? Firstly, the physiological effects on the tissue are stimulation of production of pro-collagen by the fibroblasts. Fibroblasts are going to produce pro-collagen and collagen type 1 and 3. This collagen is going to remodulate all the dermis and is going to give us the opportunity to lose the wrinkles, not by like the botulinum toxin, by relaxation of the muscle, but by neocollagenesis. So this neocollagenesis is going to help us to maintain the results during a minimum of 1 year. So the treatments are going to give us the opportunity to be effective during a minimum of 1 year, so double than botulinum toxin. How many sessions do we need? The average is 1 or 2 sessions, depending on how deep and how many wrinkles the patient has around the eyes. In the neck, do we have other solutions? We know that fractional CO2 and erbium fractional lasers are extremely risky on the neck. This is the reason why many patients who do peelings, deep peelings in the face or fractional laser in the face don't do the neck, and there is a huge difference between the quality on the face and quality on the neck. So the nanofractional frequency came to the market to help us to give the solution to those patients to assume the same result, same good result on skin condition on the face and on the neck. Does it mean that we need another technology on the face? No. It means that for the patients who are pre-treated by deep peelings and fractional erbium and fractional CO2 lasers, we have the opportunity to treat now the neck in only 2 to 3 sessions spared by 1 month. The downtime is very reduced. We are talking about 48, 72 hours on the neck. 72 hours with small dots on the neck. It doesn't mean they cannot walk. They can go walking perfectly. They're going to assume just a shallow edema and black dots corresponding to the ablation in the epidermis. The results are going to be extremely effective, as much effective as younger are the people we treat. So we know that people with less than 50 years old are going to react better than people older than 50 years old due to the ability of production of collagen by the fibroblasts, but also due to the number of fibroblasts the patient has. So after 45, 50 years old, we decrease the number of fibroblasts in our skin and we decrease the ability of production of those fibroblasts. How to solve this situation with the fractional radio frequency? We need to do more sessions on those patients. I told you before, instead of 1 to 3 sessions, we're going to move between 3 and 5 sessions on treatment. Can we combine those treatments with other techniques? Evidently. There need to be a change in life of the patient, so we need to evaluate the quantity, the amount of organic silicium and zinc in the skin, but we also need to evaluate the vascularization in the area. You know, patients who are higher vascularized are going to have better results. How to increase the vascularization in this area, around the eyes or around the neck? We have this amazing technique called multipolar radiofrequency. It's non-ablative, it's just release of radiofrequency of heat intradermal at 2 layers, papillary dermis and reticular dermis, and we do this technology just with a pre-treatment. 4-6 sessions we're going to be able to stimulate the neovascularization and vasodilatation. Neovascularization is complicated, yes, it's impossible with radiofrequency, but it's possible with magnetic field, with magnetic pulse. This technology is a patent from a company called Venus Concept, has the synergy of the radiofrequency and magnetic field, magnetic pulse. This combination is going to help us to vasodilatate, to create higher diameter of the vessel, so to enlarge the amount of oxygenation in the tissue. It means to enlarge the metabolism of the fibroblasts to produce collagen, but also to augmentate, to multiply the vessel intradermal due to the magnetic field. So it's the only way to have actually to achieve better result in older people, to give them the opportunity to increase the metabolism by increasing the vascularization. So this is the pre-treatment we're going to offer for the patient previous to the fractional radiofrequency, the multipolar radiofrequency with magnetic pulse. With those techniques, evidently, the result we're going to achieve in our patient in very complicated areas like around the eyes and in the neck are going to be much better.